For the point of this report, developments of the use of IoT software is already prevalent in the healthcare sector. Issues such as an aging world population growing disproportionately with healthcare services and manpower have already formed the catalyst for the necessity of heavy research and funding in this area. However, with the advent of the pandemic caused by the COVID strain, it has become an even more pressing issue. As the world opens up to make way for the endemic phase of the strategy, cases will naturally rise. This report shall discuss the use of IoT networking in healthcare. It will introduce the strategies, the technologies, how the technologies solve the specific issues that they were designed for, and the challenges of implementation. The Internet of Things is defined as a collection of physical objects, each playing a role in the system of collecting and exchanging data remotely for interaction between physical and cyber world. Doctors and patients can monitor, track, and record vital data and the medical information more efficiently, bringing huge improvements to medical care. IoT aims to provide services to patients that normally have to be manually performed by staff without any loss in quality. Also, data derived from patients can be collected and used for big data analytics. Such data can be used to provide timely services further. Healthcare splits into several subcategories. Firstly, connected normal operations and full suite of medical care. Simultaneous reporting and monitoring. Connected devices can collect clinical and other health data needed to use a smartphone's data connection to pass the information collected to a doctor. Next, scheduled drug delivery. Next, affordability. IoT will simplify the workflow of patient care. Healthcare IoT enables more efficient exchange of information. This allows less forms to be manually filled, hence cheaper. Next, data analysis. Big data stored in the cloud can analyze and process information to improve medical treatment. Lastly, remote medical assistance. In case of an emergency, patients can use the smart mobile app to contact a doctor who is far away. Next, emergencies. Tracking and alerts. In case of life-threatening situations, on-time alert is critical. Medical IoT devices collect vital information and transfer data to physicians for real-time tracking. When the alert is sent, hospitals can instantly dispatch their emergency services instantly. Time spent to find out and inform hospitals of the incident will be saved. Even if the person is in a remote location with no passers-by, they have a chance to be saved. Reports in an emergency can give a firm opinion on the condition of a patient regardless of the location and time. It can help to make well-versed choices and execute them on time. Lastly, the organization of hospital processes. Asset control and monitoring in hospitals. Crucial metrics like temperature, humidity, orientation, and movement sensors are monitored. Every item can be RFID tagged, and every entrance and exit can have RFID sensors installed to keep track of moving inventory. Another advantage it is that the hospitals can be transparent of its inventory. There are challenges involved. Firstly, the devices, battery life, reliability of service, hassle of use, cost and manpower of implementation, and lastly, maintenance. Next, data. Data integrity, authentication, authorization and accounting, security and data handling. Next, technology. Algorithm, ethics, scalability and flexibility of technology, and single point of failure. As the report has explained above, security is key in the healthcare sector. Databases such as the cloud storage requires authorization to sensitive information. Accessibility is done on a need-to-know basis to protect them. Blockchain technology provides anonymity and security to users' personal information in this proposed work. The authentication criteria can be fulfilled in the form of a token. The token can be generated and active only for a particular amount of time, and tracks records that are accessed. This token can be mapped to a personal information of the user, and this information can be encrypted by hash keys. In conclusion, IoT applications have great potential in streamlining many departments of the entire medical sector. However, it has its constraints.